Hello everyone, welcome back to my channel. This is Dr. Zina speaking. You have selected this video because you want to learn about the anatomy of the mandible. But before we continue, make sure to hit the subscribe button down below because it would really help me to do more videos. Mandible is the largest and the strongest bone of the face, and it's the only mobile or movable bone in the skull where you are able to open and close your mouth via the mandible. The mandible consists of a horizontal body that is located anteriorly, which is in the front side, and two vertical rami located posteriorly, backside. The body and the rami meet on each other at the angle of the mandible. So the body and the ramus, both of these, they are connected together, and this connection is referred to as the angle of the mandible. Here is a clear picture showing the horizontal body or the flat body on the floor is the body of the mandible, whereas the one that is up is the rami. The body and the rami, both of these are connected together, and the connection between them is referred to as the angle of the mandible. The body of the mandible, as you can see, it is curved and shaped much like a horseshoe, as you can see in the picture down below. This is what is a horseshoe looks like. So it looks just like a horseshoe. Connection, the body of the mandible, horseshoe shaped. From back to front, there is a connection, just like an incomplete circle. The body of the mandible has two borders. The alveolar border, located on the superior up, contains 16 sockets to hold the lower teeth, because as you can see, or as you know, that we have 16 teeth in the lower side and the 16 teeth in the upper side, which makes up a total of 32 teeth. So the alveolar border is the one that will hold the teeth in place. In addition to that, the second border is the base. The base is the one located down, inferior. It is the site of attachment for the digastric muscle medially. Here is the base of the mandible provides a site of attachment for the digastric muscle, as you can see in the picture. The body is marked in the midline by the mandibular symphysis. What is mandibular symphysis? It is a small ridge of bone that represents the fusion of the two halves during development. The symphysis encloses a triangular eminence, which is the mental protuberance, which forms the shape of the chin eventually. So that's why you cannot see in the picture the mandibular symphysis, because after the mandibular symphysis, you will end up having the mental protuberance. So after the full development of the mandible, the mandibular symphysis will become the mental protuberance, which is the chin. Your chin is the mental protuberance. Lateral to the mental protuberance, as you can see, is the mental foramen. What is the mental foramen? Foramen means it's an opening through which the neurovascular structures exits from. Which neurovascular structure? The mental nerve exits from the mental foramen. Remember, mental nerve exits from the mental foramen, the mental nerve which supplies the buccal gingiva of the lower anterior teeth. Moving on to the second part of the mandible, the mandibular rami, which project perpendicularly upwards from the angle of the mandible. So the upward part is the mandibular rami, and the downward part or the horizontal part is referred to as the body of the mandible. So the body and the rami, the connection between them is referred to as the angle of the mandible. Now the rami, it has three parts. Number one, the head. It is situated posteriorly, back side, and articulates with the temporal bone to form the temporomandibular joint, which is the main joint of the skull. The main joint of your skull is the temporomandibular joint, in which you are able to open and close your mouth by the action of this joint. The second part is the neck. It supports the head of the ramus, as you can see, and it is the site of the attachment of the lateral pterygoid muscle. Where is the lateral pterygoid muscle? I will show you a picture in a few seconds. Here is the lateral pterygoid muscle, in which the neck of the rami provides a site of attachment for the lateral pterygoid muscle. The last part in the rami is the coronoid process. It is the site of attachment of the temporalis muscle. Where it is located, I will show you a picture in a few seconds. Here is the temporalis muscle, in which the coronoid process provides a site of attachment for the temporalis muscle. Now, the internal surface of the rami is also marked by the mandibular foramen, as you can see in the picture. From its name, foramen, so it is open. Open to what? It acts as a passageway for the neurovascular structures. The mandibular foramen is located on the internal surface of the rami of the mandible inside. It serves as a conduit for the inferior alveolar nerve and inferior alveolar artery. So that's what I mean by the neurovascular structures. So the inferior alveolar nerve and inferior alveolar artery exits from the mandibular foramen. Whereas in the other words, the mental foramen is positioned on the external, outside surface of the mandibular body. Below what? Below the second premolar tooth. It allows the inferior alveolar nerve and artery to exit the mandibular canal. When the inferior alveolar nerve passes through the mental foramen, what it becomes, as I said previously, it becomes the mental nerve, which innervates the skin of the lower lip and the front of the chin. The buccal gingiva does not innervate the pulp of your teeth. Here is the mental foramen located on the exterior, outside surface of the mandible. Here is a picture for the mandibular foramen located on the internal, inside surface of the mandible. Thank you all for watching my video. If you have any questions, please do write it down in the comment section below. Goodbye now.